Hi, I'm Dr. Jerry Competiello, audiologist at SightMD in Smithtown. Thanks for tuning in to part 2 of the series. So in part 1, what we showed you was certain testing protocols, the beeps, the words, even getting your ears tested with this little machine to my right. But what happens afterwards? How do you understand what the test is all about? And what we're going to go through today is the summary and expectations or recommendations that we can provide for you. So on the screen right here, what you see is an audiogram. This is basically a graph of each particular pitch and point that we test. On this screen, you can see different pitches, so low pitch like drum beating, remember when we talked about that last time, all the way up to high pitch like birds chirping, watch ticking. The reason why we test that range is because that's where all the speech sounds are encompassed in. So again, we're making sure that you're understanding those speech details as they're coming through. On the side of the graph is how loud those sounds have to be in order for you to hear them very slightly, which we consider threshold. On the side graph, anything from -10 to roughly about 20 is the acceptable range of hearing. Anything below that are different degrees of hearing loss. So as you can see with these red circles, which is an indicator for your right ear, and the blue X's, indicator for your left ear, is that in certain pitches we have normal hearing, certain pitches is not so bad, but in other pitches there may be a little bit more hearing loss. It's very important to test each particular pitch so that way we have a better understanding of you and your hearing. On this particular graph, or summary as we like to call it, what we can see is that the hearing here is within normal limits. However, as it starts to travel across into the higher frequencies, which are designed to give us more clarity of people's voices and speech details, we start to tailor off into about a moderately severe hearing loss in both ears. With this particular patient or structure of hearing loss, many patients feel that they do okay one-on-one. They also do all right with TV as well as telephone. However, their biggest culprit or biggest area of concern is in background noise. And many people, when they think about background noise, they think about restaurants or supermarkets, but it actually could be just a couple of people at home with the TV on or water running. And that's because your brain is competing with all the sounds, trying to make sense of what's going on in its environment. My favorite analogy on hearing loss that for patients to understand is like playing Wheel of Fortune. Based on a 10-letter word, if let's say 7 letters are showing, it's much easier for the brain or for you and I who are playing at home to understand what that word is and fill in the blanks. However, if only 5 or 4 of those letters are showing, then it's much harder and putting a lot more effort into figuring out what that word is. Same thing applies with your hearing. One-on-one, although with this particular structure of hearing loss, you're maybe missing 3 out of the letters, but your brain is doing a great job of filling in the blanks. However, once sound is present or competing sound is present in the environment, then it starts to drop back because now the brain has another signal to worry about. And then it becomes about 4 to 5. And you're putting a lot more effort as well as cognitive overload to understand what those words are. So for patients like this, our recommendation would be a device. It would be what's called a receiver in the ear that has a really great noise management system, because our low frequencies are responsible for volume. Our high frequencies are responsible for clarity. So we want to be able to maintain that volume so you can hear people around you. However, we want to extract those speech details so that way you can grab them in complex listening environments.